it's a mechanical process which removes waste products and extra fluid from your body when your own kidneys are unable to do that. We use a special membrane which can do that very effectively, keep your electrolytes in balance, remove waste products, and that membrane is called a filter or a dialyzer. There are two types of dialysis, hemodialysis and peritoneal dialysis. And in case of hemodialysis, we use that dialyzer. In peritoneal dialysis, we use a membrane which lines the inside part of your abdominal cavity called peritoneal membrane as a dialyzer. Most people need to start dialysis when their kidney function falls below 10 to 15%, because at that time your own kidneys are unable to clear waste products from your body. They cannot keep very important electrolytes in a safe range in your body, and also cannot remove extra fluid that gets accumulated in your body. There have been medical research has shown that people who are diabetics, you can actually start dialysis when their kidney function falls below 15% and they do better. For most of the other patients who have chronic kidney failure due to other reasons like hypertension, heart disease, or autoimmune or inflammatory diseases of the kidneys, they can start dialysis when kidney function is less than 10%.
Most common side effects of dialysis are usually related to fluid gain, and so low blood pressure and cramping. So typically, the less fluid gains that a dialysis patient has between treatments, most of them tolerate the treatment pretty well. However, with excessive fluid gains, they can drop their blood pressure, since we're trying to take off a lot of fluid in a very short period of time. In addition, if we take off too much fluid, they can get muscle cramping, just like you would get if you got dehydrated from an activity. There are ways on dialysis to minimize those issues. We can adjust the dialysis machine and use certain profiles to minimize those side effects. Again, most patients tolerate it pretty well. Another problem would be a dialyzer reaction, which is very rare. But there are different types of dialyzers that we can use to minimize that effect as well. Dialysis typically takes around 4 hours. However, it's dependent on a few things. One is the size of the patient. Another is how much fluid gains between treatments, and also how much kidney function you may have left. They all kind of impact on how we calculate dialysis time. But typically for the average size of a patient, 4 hours and 3 times a week. There are other ways to do dialysis, and if you do dialysis at home, hemodialysis, that can be adjusted as well, and that may be more frequent but less treatment time. For the majority of the patients at the dialysis unit, they're on dialysis for the rest of their lives. There are a small percentage of patients are on for acute issues that are reversible, and they will only be on dialysis until they recover enough kidney function to get off dialysis. However, the majority of patients have end-stage kidney from a chronic problem that's caused their kidney function to deteriorate over years, and that's not reversible. However, for appropriate patients, transplant is an option to get them off dialysis.